Life, it comes at us like a train with all its ups and downs, its pains and its joys. How do we deal with it? How do we process it? How, how do, what we learn from life, and especially what we teach life back in return, makes all of the difference. Welcome to Life Talks. Hi. So I came back to close out this month with some information. For the last 3 weeks, you have been taking a journey with Stephanie and myself concerning our hysterectomies that we had a day apart from each other. Stephanie lives in Limon, Costa Rica, and I live in Michigan. And one thing that we learned was that there is a global sisterhood of women who have gone through the same journey, had the same procedure, but variations of it, but who share some commonalities. And that is why we felt it was so important for us to come and share some of the things that we have learned through the recovery period. Actually, the post, the surgery, and then the recovery period. But there's no way that Stephanie and I could have covered all of the various factors that are involved in having a hysterectomy. So what I wanted to do today was to just share a little bit more about some of the things that we did not talk about, and also to raise awareness about a very deadly cancer that takes the lives of millions of women every day, but also millions of women survive it, and that is cervical cancer. And the month of January is Cervical Cancer Awareness Month. I dedicate this program to a very special friend of mine, Samina Sepal, who is a survivor and one of the strongest women I know. She was supposed to come on and do this program with me to talk about cervical cancer and to talk about her journey of her fight with it and her survival of it. But she is not doing too well right now. And she is also still grieving the loss of her son. And so, Samina, from sister to sister, this show is for you. So to start off, closing off the hysterectomy journey, there was one of the things that I wanted to really talk about, and that is the difference between having an advocate and a mentor to be with you on the journey. I asked a friend of mine who is a nurse at a hospital in Maryland, Lenora, on the difference, because I was mistaken about the meaning of the difference, or I was using the words incorrectly. So at first I thought having an advocate was to have someone there for you who could speak up for you, which in a sense is. But what she explained to me was that having an advocate means that this person is legally has been given legal permission by you or in some process to speak on your behalf, to make decisions for you, and even to be spoken to on your behalf. So for instance, you're going to surgery and no one else is there for you when you come out of surgery. Normally they'll speak to the next of kin, a family member, or someone who's listed to be spoken to for you. And so for what she explained, having an advocate is given legal access to the doctors, and they can also, like I said, make decisions for you. This is important if you are alone and you don't have any other person to who can speak on your behalf and actually help get the care that you need. What she did explain, which is very important, is that that's really the nurse's job in a sense. The nurses are supposed to advocate for you. They're supposed to make sure that your meds and everything is, going the way that it should be. They should be the ones to look and see if something's going wrong and to raise that voice for you. That happens, I would say, most of the times, but there's some times when it doesn't always happen that way. And so if you are in a state where you cannot speak for yourself, or you're pretty heavily sedated and you kind of don't know what's going on, these are the two choices that you have. You can have that legal advocate, or in addition to that, there is the other side of it, which I was mistakenly swapping for an advocate, but to have a mentor with you. A mentor is someone that can go to your doctor's office appointments with you, who can be in the room with you, who can even ask explanations so that things can be clearer. These are mentors. She herself, Lenora, has acted as mentors for plenty of people, including myself. But she gave an example of a friend of hers who had called on the phone because there is something going on with another friend, and she was able to say, okay, ask them to do this, ask them to do that. These are mentors who can help guide in the process. A mentor could be someone who is very knowledgeable about that particular medical procedure that you're going through, or even before you know what is supposed to happen, who's knowledgeable about maybe the medical terminology and can ask you to ask certain follow-up questions. In my case, I was blessed to have many people who are in the medical field that I was able to call and say, well, my doctor said such and such, and they would either confirm it. And it's not that I was piggybacking or I was trying to make sure that she was doing what she was doing, but, this is your health. You take responsibility for it. So I even have a particular friend of mine who is a medical doctor too, and within our friendship, us talking about it, he was asking me certain questions. Well, what kind of test are they doing? Is it that particular test? And if it was a particular test, well, why are they doing that particular test? Because they may not need to be doing that particular test. What kind of medication do they have you on? How is that dosage? Did you talk about the other medication that you on? Is it going to interact with it? All of these things that we don't think about to ask, because you know what? When you are in pain, you're not thinking to have some kind of thorough conversation with your doctor. It's just a reality of it. If you're bent over in pain, the last thing that you're doing is asking your doctor to explain a certain terminology. But medical records are good to have so they can see if you're on a certain amount of medication. I will be a little transparent right now. What I did was every time I had to go to the hospital, I had certain friends here on campus who I would call and ask to go with me. And by the time I had gone in quite enough times, there was a certain number of people who knew the drill. They knew when we went in there to give the insurance card, where to take me, what to tell them. They had the list of my allergies, the medications also that I am on. They had everything. It was like rehearsed. And that is something I went through with them because I knew whenever I entered into a crisis with pain, I could not talk. I could not talk until medication was in my system. And so before that, you get in there and all the doctors are asking you a gazillion questions. They knew to pull out their phone or to say X, Y, and Z. These are the mentors that you should have in your corner. For a long time, I had either good friends or the children, but also to have someone who knows enough or has enough, I should say, courage, who has enough courage that if it's visible that you need help and attention, that they won't just sit in the room and watch TV or be on their phone, but they will get up and they would be proactive. They will call the doctor, or they would ask questions, or if you're saying that you need help, that they will get up and do that. we need people like that in our corner. It's good to go with even a follow-up. Bring someone with you so that they can be there with the process. I know, especially after surgery, you are on medication for a long time. Some people don't do it, but you don't remember everything. Most of the time you are sleeping. I have one friend of mine who just asked me if I remembered her talking to me on FaceTime in the hospital. I didn't even remember that. And she said we talked, and I asked her, like how come she was there and all that kind of stuff, which is pretty hilarious. But the reality is, like, you're drugged, you don't remember anything. And most of the times we really just need to rest. We want to rest. So just make sure you have someone who knows your history. Take your time and even write it down and send it to them in a text message so they have everything. And if you need to, get an advocate, give them someone you trust. So if it comes to life or death, they'll make the right decision. But someone who can help work with the doctors to make the right decision for your care. The other thing I wanted to talk about when it came to even with the hysterectomy. Now this video is now Stephanie and I are now 6 weeks post-op, and I went to my doctor this week to get clearance to go back to school. And I have had a situation that came up, and I just not feeling 100%. But to be able to speak to my doctor and share with her exactly what I was feeling so that she can do some follow-up tests was really crucial and imperative. It is really, really important. I am begging you, if something doesn't feel right, no matter what it is, say it. Even if you feel that it is part of the recovery process, I don't care, say it. I was still feeling some pangs and, having some issues and just feeling some pulling and pain. And I assumed that it was just the healing process, but it has ended up being something more than that. So I am just asking that even if you feel an extra pull or a tug, or you're tired or you're sleepy or you just, whatever the case may be, tell your doctor everything. And even when you're explaining it, even if you have to use the most elementary words, like I was saying, it feels like knives. That's the only word I could have used to describe it. They can figure it out. Let them know. I also wanted to talk about some things that I personally am not going to go through, but I've been given permission to share about a friend that I met today, actually, Kim, and I met her on the phone. Actually, had called one of my credit cards to settle some stuff that was going on, and the representative on there, we began to talk, and she said, she had permission to talk because she's just a talker. So anyway, Kim, Kim has shared some real insight with me, and she gave permission for me to share it with you. And Kim is in her 40s also, but she herself had gone through many, many years since her 20s of pain and issues with her uterus and womb. She had a hysterectomy when she was around, she said, between 41, 42, same age as I am. However, she had a complete hysterectomy. And like I had said before, I did not have a complete hysterectomy. My ovaries are still intact, and they better stay intact because we're just not going to go through that again. But she said that there were some things that were just unexpected. And had she not talked to her sisterhood, which again is so important, she would not have known to expect certain things. And so here are a couple of things that Kim shared with me today. For if you have had a complete hysterectomy, she said it takes about 6 to 8 months, according to what she had been shared, for your hormones to be completely depleted. And once they're completely depleted, that's when things kick in. She said she is someone who was the one at a movie where everybody else is sobbing, She's the one who would just still have the driest of eyes. She would not cry. She's not an emotional person. But her friend asked her actually, have you started crying yet? And she was like, no, why? Now Kim says she'll cry at the drop of a hat. She's so emotional. Her emotions are just all over the place. She said, again, the hormones take time to be depleted, but once they're gone, please talk to your doctor about things that you can take to help with some of those symptoms that are going to start. One of the things is menopause. You get kicked into menopause really, because your hormones are gone, and you need to understand that and actually come to that realization. I don't want to use the word acceptance, because you shouldn't tell somebody to accept something, but with the partnership of your doctor and a counselor and a support system, you would be able to start that process and maneuver through all of the things that come with that new stage of existence. She says that Ambien works really well, and you can also try some natural help like black cohosh. And you, again, talk with your doctor. Naturopathic doctors are really knowledgeable, and even some friends, and see what they have taken to help. It is really, really important that you don't go through things by yourself. She says that, for her, the hot flashes are very, very intense. She said this in a jovial way, but the hot flashes sometimes feel like you're dying. And there was one time when she went into her garage and laid on the hard floor because she just needed some kind of relief. So whatever it is that you need, with the ice packs or the windows open, and with that also can come some really sleepless nights because you are drenched a lot, you feel the hot flash coming up. I am not in menopause, nor will I end up in early menopause, or when I say early, like aside from the normal progress of getting into menopause. But there was a time when my hormones were acting the nuts from my spine and the disorder that I have in my spine. And there was a couple of months where I was flashing. And literally you feel it like coming from, for me, the bottom of your foot, and you just feel this heat coming on like your foot is on the oven, and it just comes, and by the time it hits your head, you're drenched. And I remember that feeling, and just wanting to just rip my clothes off, or just wanting to just stick my head inside in fact, my whole body inside a refrigerator. And that lasted a short time, but I cannot imagine what Kim and many of you, or someone that you know, is going through where that is concerned. Another thing that she said, which to me was so profound, she said, things can change for you and not for the other person. I think that's part of why it was important for Stephanie and I to come on together, so that you could see kind of like two sides of a coin, our coin. But again, between Stephanie and myself, we cannot say that what will happen to me will happen to you. So you have to know yourself and pay attention to yourself, and journal and share with your doctor, and keep in touch with your doctor to let them know everything that is going on. One thing that we talked about today, and this is Kim and myself again, we just been on the phone, was probably one of the most important things, and Stephanie and I said it too, was just the support, having a support system. And I want to encourage, if anybody watches this, if you are able to have a support group for women who have had a hysterectomy, please do so. And use and utilize all of the resources that you can utilize. Go to the hospital, go to a women's center, and see if they can provide some free counseling for you guys, from information that you can share. But the most important thing is for women to know that they're not alone, and to give them a space to share. The hardest thing is to try to share with someone something that we've gone through when they have no clue, when they will not have any clue unless they've been through it. It's just very tiresome. It's very draining, and sometimes it can be very frustrated. I know the sisterhood that I have now. I can just send one text. It doesn't even have to be a full sentence. It can be, you know, my pee did it to me again, or going to the bathroom is still so difficult for me. And I wouldn't have to explain anything else. They know exactly what I'm talking about, because at some point there is a commonality in the recovery period that we all go through. There is discomfort. There is our bodily functions having to get back normal. There is the walking that we have to do. There is the bowels that we have to move. There's certain things that we all share so that we can be free within that safe space to say, hey, you know, going to the bathroom this time was not like going to Disneyland. And we won't have to explain it. So that is what I mean. Try to see if you can find a support system or a support group, or start one yourself. Never know. And one of the most important things, again, that she said was, you know, for us, and for someone who may be contemplating it, because she waited a really long time, and I did too. I waited 19 years. And part of it was the concern or the fear that if I do this, things are going to change. But then you live 19 years with discomfort and pain and hospital visits. Y'all don't want to know my hospital bill. But just having to live through all of that. And then, you know, for me, it was the fear of traveling, because I go overseas and then I have a crisis and I have to, my medicine packet that I used to travel with in my suitcase was so big. I took everything. I never left any meds, because I was always so afraid that if I go overseas, that something would happen and I would have left a medication home. So it was really inconvenient living with this It was really inconvenient living with this pain. So the surgery may not be an option for everyone, but technology is so advanced right now. Now, granted, it depends on the place of the world you're in. Like, for instance, in Stephanie's case, in Limon, they do not have the robot assistance for it, but I had a less invasive procedure. But if you deal with this now, you deal with the surgery now, you deal with the recovery, you deal with the minor inconveniences to avoid the pain, which lasts long. It affects your livelihood. It affects your work. You know, you can't go to work if you're in the hospital with pain. You can't go to work, you don't get paid. You don't get paid, you can't pay your bills, you can't buy food, you can't take care of your family. A 6-week medical leave of trying to get yourself together is really a minor inconvenience versus years and years and years and years of pain. So that's all I have for you for now. I do also have to say, just make sure to keep moving. It really does help with the healing process, and just be patient with yourself. Be patient with yourself, with your activities. Take it slow. Listen to your body, please. And one thing my doctor said to me this week, which I had to really say, okay, listen to what she said and pay attention to it. Stuff may be healed on the outside, and the stitches may have been dissolved. However, it does take a few months, because inside stuff takes a while to heal. She said to me, you may not feel like your full self for a good 4 months, around there. So I have to bear that in mind, because in my mind, it's like 6 weeks. They give you clearance to go back to work and to resume activities. What they're saying is that you can go and you can do what you need to do, but please be in mind that your organs do not heal in 6 weeks. The inside takes a while, and to really be patient with yourself. Get the sleep that you need, drink enough water, and try to make your life as simple as possible. On the water aspect, some things that we don't really talk about. Leading up to surgery, during surgery, after surgery, after surgery, you may have taken quite a bit of medication, quite a bit. And the flushing out for your kidneys and your liver that needs to happen, even down to a microcellular level, it's really important. It's a lot of medication. We take pain medication and this medication and that medication and medication. And even though you're down to maybe not taking as many, like as me, I don't take pain meds anymore, but it's still a lot that my body has taken. So it might be good to even try to think about some ways to detox your body. Yes, you up on the water and you take, whether it's cranberry juice or whatever are the things that can help aid your liver to detox itself, even to help your kidneys to process through that stuff, for your cells to be able to make new cells and regenerate and rejuvenate a little bit quicker, so that you can do a turnover of your cells a little bit quicker. I cannot stress how important it is to get your body cleansed of all of the stuff that it has ingested. It is part of that healing process going a little bit faster, and you actually will give your body that boost to be able to bounce back a little quicker. And just, if you don't believe me, just think about it. If you don't drink enough water after a surgery, what are you looking at? You're looking at constipation, you're looking at dehydration, you're looking at dizziness and fatigue. And what does dehydration do? It sets off something else. Your urine is not clean, your kidneys, you just at so many risks when you are not flushing your system out. That is not something that you can afford to do when your body has been under such a traumatic experience and it is trying to heal from trauma. So give your body every tool, every weapon it can possibly get to fight back and win. Please. All right, so the cervical cancer now. Cervical Cancer Month. Cervical cancer is something that has affected more than enough of my friends. I hate this cancer, but it is a reality, and it is something that we really, as women, need to be educated about and pay attention to. So just here's a little bit of statistics. The cervix is the lower part of the uterus, and my cervix is intact. And that's one of the things that, even with your hysterectomy, you need to ask, what are you taking out and what are you leaving? And if you don't know the anatomy of the body, then you ask your doctor, can you show me? Show me where my ovaries are. Show me where the uterus is. Show me where the cervix is. Show me where the vaginal canal is. Show me everything. And with the surgery, show me exactly what you're taking out. Show me where you're leaving. Show me how you're going to take it out. I had to ask the question, where are you taking the uterus out from if you're not going to cut me open? It's still, you need to know. It's your body, okay? It's yours. It's nobody else's. It's not even your doctor's own. It's your body, and you need to know what's there, how it stayed there, or what was taken out, why they took it out, where they took it out from. So the cervix is the lower part of the uterus where the baby grows during pregnancy. Cervical cancer is caused by a virus called HPV. The virus spreads through sexual contact. Most women's bodies are able to fight HPV infection, but sometimes the virus leads to cancer. You're at a higher risk if you smoke, have had many children, use birth control pills for a long time, or have HIV infection. Cervical cancer may not cause any symptoms at first. Later, you may have pelvic pain or bleeding from the vagina. It usually takes several years for normal cells in the cervix to turn into cancer cells. Your healthcare provider can find abnormal cells by doing a pap test to examine cells from the cervix. You may also have an HPV test. If your results are abnormal, you may need a biopsy or other tests. By getting regular screenings, you can find and treat any problems before they turn into cancer. And treatments for this cancer include surgery, radiation therapy, chemotherapy, or a combination of both. The choice of treatment depends on the size of the tumor, whether the cancer has spread, and whether you would like to become pregnant someday. Vaccines can also protect against several types of HPV, including some that can cause cancer. This is taken from the U.S. National Library of Medicine. Sisters, please get your pap tests, get your pap exams, do your pap exams, please. Do them when they tell you you need to do them. If you have never done a pap smear, please go. Call your gynecologist, call your doctor, and ask her to refer you to a gynecologist. It is really, really important. We don't have to die from this. We don't. Early screening is so important. But if you have it, or you are a survivor from it, you are one of those who can share the importance of early detection. And I'm just telling you, from seeing how my sister friend fought this thing, it is something that I would not wish on anybody. So for the sake of a good life and having a good quality of life, please get tested. January is Cervical Cancer Awareness Month, but 365 days a year, you have the opportunity to at least put yourself in a safe zone. And if they do find something abnormal, to start the fight and give yourself a better chance to win. Thank you so much for coming and joining me. You know, I really appreciate you coming to my channel. If you have not subscribed, what are you waiting for? There's more good stuff just like this coming on, so go ahead and hit that button. Subscribe to the channel, share this video, and you can send your questions to my life talks, life, L-I-F-E, talks with an S, TV@gmail.com. Until next time, take care, be in peace, laugh a lot, cry if you need to, and enjoy your best life. Until next time, bye. Thank you for joining us on another episode of Life Talks. I hope that you were inspired and that you have felt a rejuvenation in your life. And I hope that what you are saying right now is that the answer that you are given to what life has thrown at you is that I am still here. Email us with your Life Talk ideas at mylifetalkstv@gmail.com. See you next time.